I'm Margaret Doria. I'm a student here at UT Health Science Center. We are the pediatric room of the Center for Simulation Innovation. The purpose of this video is to introduce you to the ALARIS pump, which is used at University Hospital and at the Children's Hospital of San Antonio. So, first, you need a primary IV tubing, which is this one. And this is specific to ALARIS. It says it right there, ALARIS pump. So first you want to take this blue tube out and try not to touch that part. Take that out. Make sure your clamp is clamped all the way. Bag. There's another one there. Okay. So squeeze right here. And just unclamp. Once you have your line primed, we're ready to insert it into the machine. So just lift this up. So this is your cassette. The blue part goes right there. And this fits right in there. Close it. There. We've connected their line to our patient. Now let's turn on our pump. System on. Right there. So this is your pump. The center is the brain of your pump, basically. And you have your two channels here. So you could run two medications at the same time. All right, so now it's asking us, new patient, we'll say yes. And it's peds less than 40 kilograms. In this case, our baby is 8 kilograms. So say yes. This is where you enter patient ID. You have your letters here. Once you have that down, confirm here. Okay. So we're running our IV fluids here. So anytime you want to program your line, you always want to do channel select. So push that button here, and we're going to use this channel. So it gives you guardrail drugs, IV fluids, and basic infusion. Since this is just IV fluids, we'll pick that one. And it gives you a list of the common IV fluids that you may run. We have 0.9% normal saline. Pick that one. Is this correct? Say yes here. Okay, now we're going to set our rate. So just push rate there, and our rate is 40 mils per hour. Then go down to VTBI, which means volume to be infused. And in pediatrics, we want to set our pump to a maximum of 2 hours. So that's 80. And that's so we can go back to the room and check our patient, check the IV site. And then it doesn't give us duration here, but here at the bottom you'll see delay options. You have volume, duration, secondary, and start. See, at one point your pump will beep at you. That's when the silence button is useful, which is right here. So you just press that. So volume duration, when we pick that one, it gives you 2 hours there. Now you're ready to start. Okay. And if you look here, it tells you what's running in that line. So it's running at 40, and that's 0.9% NS. I don't know if you caught that right there. So you know that your normal saline is running on this line. If at any time we need to change the rate, so for example, we got an order from the physician to change the rate. So again, channel select. Anytime you program your pump, and you pick rate here. Say we want it to be 50 an hour. So just do that 50. And start. Our IV fluids is running on channel A. Now we're going to be using channel B to give medications to our patient. So your medications can come in a syringe or a bag. We'll start with the syringe. And you need a special tubing for your syringe, which looks like this. I'll be close. Okay. All right. This is the tubing that you need for your syringe for this specific pump. So first you want to prime your tubing with just a saline flush. Okay. And this part here needs to be sterile all the time. Okay, unscrew that. That just goes in there. Okay. You want to snap this part off. Make sure all clamps are off. And then you prime the tubing. So you just push this. All right, now it's primed. Clamp. Disconnect that. Put our cap back on. Okay. Now we'll insert it into our pump. So just lift this. And we're using channel B this time. So again, this blue cassette goes right in there, and this fits there. We have an alarm. Just close that. Okay. Now let's connect our syringe to the tubing. Just unscrews there. And again, this fits right there. Make sure you have a good seal. Okay. So now we'll program our pump. Again, channel select. And then we'll pick guardrail drugs. We have vancomycin here. Guardrail drugs. And it gives you a list of your medications. We have vancomycin. This is U to Z. So we'll pick that. And vancomycin. Pick that one. It asks you for the dose. So just do yes. Drug amount. Here we have 93 milligrams. We'll pick volume. We have 28 mils. And our patient weight is 8 kilograms. And I'll just do next here. Okay. So we'll set our duration. So vancomycin, we always want to give it over an hour. So 60 minutes. And that's 28 mils per hour. And again, start. And if you look here, you see your green light. You know that your fluid is running. And it tells you there vancomycin. And it gives you the dose. And your rate, 28 mils per hour. Now let's go over a medication in a bag. So you have your bag here, and you're going to need a secondary IV set, which is this one. So in the bag you have this extension hook, which we'll use later, and your tubing. Okay. So we'll prime your tubing, make sure that's clamped, keeping everything sterile. There. There, your chamber. Okay, and this is when you'll use your hook. So you want your medication to be on top and your IV fluid at the bottom. That. Just hook that in there. Okay, right there. And then we'll connect it to our primary IV. So right here, clean that part, scrub for 15 seconds, and we'll connect. Okay. And then you want your clamp all the way up, so you want it unclamped. Okay. So let's program our piggyback medication. So we're going to use this channel, channel select. And see here it tells you secondary, we'll pick that one, secondary. Then our drug is ceftriaxone. Pick that one. We're not using it for meningitis, we'll pick other. And our dose is not 1,000 milligrams in 50, so we'll enter that ourselves. So yes. Okay, so our dose is 1,500 milligrams. This is coming from your order in 100 mils. Okay, so we have a new patient. Our patient is 30 kilograms, so that's right. And then we'll do next. Okay, and we want that to run 30 minutes. Okay, that's going to run 200 there. And then just start. Okay, so if you look here, it'll tell you secondary. And it tells you the drug, ceftriaxone, and it's running at 200 mils per hour. Common alarms that you may hear include air occlusion alarms or infusion complete when your fluid is finished infusing. So if that happens, you want to just hit the silence button, read the screen, and if you're unsure, just call your instructor or RN. Thank you for your time. I hope this video has been helpful.